4,600. So you will see a discrepancy in there. But as we have requested, we still need additional money to cater for the ECCIF. On the issue of indigents, previously we used to pay for the indigents, and that figure used to be constant. It was a figure that was a number that was submitted by the social protection. We had a meeting with social protection. We have told them to revise that list, and we have been given the list, and therefore we are going to update. We have 950 million Kenya shillings that now we want to pay for those indigents that have been identified by social protection. We also subject the indigents to what's called a means testing to ascertain whether they are able to pay or not. On the question of the former NHIF staff, honorable members, all NHIF staff currently have been onboarded back to the public service and deployed to Social Health Authority for a period of 6 months to support SHA in implementation of the rollout, to give SHA an opportunity to onboard the number of staff that they will require. The rest of the staff that will not be onboarded into SHA will revert back to their public service, and they will be posted to any of the government agencies. So no member of staff of SHA will lose their jobs because they are already public servants. Honorable John Paul, on the issue of the shift not working, I want to confirm here that where the facilities have been empaneled, those facilities are providing services under SHA. Those that have not been empaneled or accepted to be empaneled are the ones that are not offering services under SHA. The issue of payment for medicine, I think once you go for treatment, the doctor looks at, examines you, gives you a prescription, and therefore that is what is prescribed as your benefits. It includes medicine. On the issue of the patient who came to petition the Minister of Health, honorable members, we take note, and what Madenga has said is true. We had that system downtime at that particular time, and specifically where we had a big challenge was KNH, Kenyatta National Hospital, and that issue was addressed. The only, I think, what the police or the DCI have come to do is the chaos that the patient came to cause at the ministry. Otherwise, the ministry acknowledges, and SHA also acknowledges. Honorable members, I have said we apologize. We apologize first for there was downtime. I want to leave that.
I'll give you as a follow-up, as a point of order on that issue. P.S. Kimutai, please note that this is a very common issue, and there needs to be a whole government approach on it.
Speaker, thank you, Honorable Speaker.
Thank you. Thank you, Madam Speaker. Thank you, the PS, for your answer. Madam PS, you can see this is an issue that touches every member. The woman who was harassed is 61 years old. That's an elderly woman. Somebody's grandmother, not just her mother. Yes. And on top of that, this is a person who was seeking services. Yes. Was frustrated. You have acknowledged there was a problem. Why is that woman being arrested? I am asking the police, please arrest the people who disrupted the system. They are the ones who are causing disturbance by disrupting the system. Not a woman who is sick, who is seeking assistance. It's very annoying. Honestly, it's very annoying. When you see a woman 61 years of age, 61 years of age, 61 years of age.
Thank you, Speaker. Thank you. I think the Speaker has directed that this. Speaker, whether...
You made your point.
Honorable Speaker, on the question from Honorable Salasha, whether public participation was conducted, I want to confirm to the members that public participation was conducted when we were coming up with the Social Health Authority Act and the other acts, and I think, honorable members, the House also participated, the Committee of Health also participated in public participation.
Has made a point on behalf of all. And let's now listen to the other issue.
And best,
they will address it, don't worry. Order.
The honorable member Salashi also asked whether we learned from the previous launch, the experiences of the previous launch of the UHC. I want to confirm that indeed we learned from the experiences of the piloted 4 counties. And what we noted then was that there was lack of legal framework to support universal health care coverage, and that's why we passed the 4 laws that are meant to support the rollout of the UHC. On the issue of the cancer patients, we take note and have said that we have considered a committee, a team, what's called the Committee of the Benefit and Tariff Package membership, that will review the benefit package for cancer patients, because we realize that the cost of treating cancer has gone up and we shall adjust according to the market rates. Honorable Mutunga, Dr. Mutunga, on why the confusion during the transition. There's always bound to be confusion because we took members of those members who are managing facilities, we took them through in terms of what are they supposed to do with the system. They needed to understand how the system works. How do a person comes? You remember we said we use your ID card. So there are those who are facing challenges. Some of those, when they go to the facility, you realize that they are not paid for their premiums. So at that particular time, some of the members of the public or patients were being told, you either pay cash or have your premiums activated. And I think that is where we had some challenges. I've talked about the oncology benefits, and I think I've said we are having a committee that's going to review these benefits of the oncology, which is specifically cancer. Honorable Madenge, I think the issue of grace has been addressed. The NHIF system, I've also talked about the indigents. We have the 950 million, which we are now working with the State Department for Social Protection to ensure that we capture those ones and we pay for them. The issue of no visibility of SHA system in the branches. I think the system is used by the facilities. All the facilities who have been on panel can access the system, can use it, and they can see the claims that they have lodged. So I think there's visibility. And on the issue of the SHA staff, I think they have also the rights to access the system. Those who are supposed to access the system are given rights. Honorable Emase, on how long does it take to activate the data of an individual? I say that immediately you register and you're a paid up member, you're an active member there and there. So it doesn't take long for you to be activated. Patients who are registered and not paid up, yes, any patient who is registered and not paid up, when you go to level 4, level 5, level 6, where we expect you to use your social life insurance fund contribution or premiums, you will get services there. But if you have not paid, definitely, the eligibility will be that you have not paid up member and therefore it will reject you. But for those who have registered, they can access their services at level 2 and level 3 without paying any premiums.